Okay.
Is she live? Good. Sorry.
Good. So today you practice placing, graft dissection through the entire day. You learn about what you're supposed to do. So this presentation is about what happens when your patient comes back, you look at the results, and then you realize something went wrong. How do you backtrack to understand what went wrong? It's very helpful to, I'm not advancing my slides. Oh, I'm sorry. It's very helpful to be very detailed about your documentation. So in our office, I'm too loud. In our office, in our documentation, we record not only the anesthetic, but we record the size of the site and the number of grafts that was placed per that size of the site. Then we record at what time we started dissection, whether it's FU or FUT, at what time we stopped. We record what time we started placing, what time we stopped. If we harvest one strip, how long it is, whether there's a scar in it. We record additional notes would refer whether the tissue was fibrotic, whether the tissue was denser or sparser than anticipated, whether the grafts dissected easily, whether they're placed easily. So when the patient comes back, it gives us a great feedback. Whether the patient metabolized anesthetic faster, started bleeding during the placement. So all that is important, but also we record what assistants placed at what part of the head. So if something goes wrong, then we can go back and look at our records and analyze and figure out what happened. So what we're going to talk about is that there are several areas in which you can make a mistake, but where things may go wrong. So one is during the planning, the other one would be during donor harvesting, graft preparation, then we're looking at recipient site creation, and then we look at the graft placement. So what I'm going to ask you is to, when you see the next slide, you can ask, what I'm asking you here is, do you think that this is poor planning? Do you think it's related to maybe graft preparation, graft placement? What could be the reason for this poor growth? As you see, this side didn't grow well. This is a patient 5 months after the hair transplant. This side is starting maybe 4 months after starting to grow, but this side is not growing well. And there is a midline that is the least growth, right? So I will not be asking you questions, but I would like you to kind of run through your head when you see this first slide with a question mark to kind of ask yourself, what do I think may have gone wrong? In this particular case it could be during the extraction. If it was a follicular unit extraction, you can transect the grafts, you can damage them during the extraction. It could happen during the graft preparation, graft preparation placement. What did I do? It could be graft placement. This is transections. And then another thing is it could happen by making too many sites or sites too deep where the blood supply got compromised. In this specific case, we were able to trace back to the surgical assistant who was used to placing FUT grafts. When she saw FUE grafts, she was nervous and sorting. I mentioned this earlier. And then the grafts got dry and damaged by her sorting, trying to find a good graft, healthier graft. So sometimes you think it can't be experienced assistant, but if something changes in a practice, that experienced assistant may not be handling the change as expected. And then the other thing, sometimes if you're looking at the midline being the poorest, it probably is also a compromised blood supply. Too many sites close together can do that, and then it could be sites too deep. This is unnatural. Would it be poor planning, poor placing, poor graft recipient site creation? In this specific case, what you're looking at is you're seeing that not only that the hairs are pointing up and slightly backwards, but also there's an unnatural growth. You see that hair comes out and you can clearly see the exit point. It's called pitting. The grafts were placed too deep and then the pitting was created. Can you see it here? It doesn't look like a smooth growth. There's a slightly that indentation around the exit point. And what happens is during the graft placement, the grafts were too deep and they needed to be pulled out. Either the sites were too deep, the grafts were too short, so that the measuring, when the test happened, the measurement was not correct. Even when you put the graft against the blade and make sites, sometimes the tissue is softer and the pressure of the incision can make a site deeper. It's always important to test about 10 sites and see how they fit. So this is a natural, it looks like a doll hair, but what happened here is this hair looks different. This graft grew and looks different than this graft or that graft. So in this particular case, this is called the compression. And so the grafts, if there's and I'm going to show 4 hairs so you can understand better. If there are 4 hairs in a graft and the site is big enough, they're going to come out, when the hair grows, it'll come out with a proper spacing between. But if the site is too small, when they start growing out, they don't have enough room to spread, so that's what happened. So if you look, this is an old hair transplant where the 2 follicular units were transplanted at the same time. However, you can see about line of 4 hairs nicely spread, and then there's this clump. So even today with follicular unit grafts, they are small. If the tissue is not trimmed properly, if you try to squeeze this in a small site, it won't work. That's what it looks like, and probably when it grows, it will look like a little plug. So the next one would be, sometimes, here you can see better. So the temporal point was restored on this patient, but what he described is something, once again, they don't know what exactly didn't go well, but something does not look right. So in this patient, the grafts were placed, there are 2 hair grafts very close forward, and sometimes the curl was pointing up. So the hair angle needed to be lower, so it's elevated. 2 hair grafts were placed in a hairline, and plus sometimes in some of these grafts the curl is pointing upwards. So there are mistakes, we saw this earlier, where the judgment, instead of recognizing telogen hair in noticing that as a 2 hair graft, it was considered as a 1 hair graft and placed in a hairline. And then sometimes recipient sites are not created a proper angle. This is another patient who came in with complaint that he couldn't style his hair, and what happened is someone did his hair transplant and it didn't look natural because all hairs were pointing in different directions. These go there that way, this goes that way, this goes back, this was pointing that way, this is going forward. So whoever was not placing in the curl in a proper direction. And so the patient would tell you, I don't like it, this is not right. He cut his hair short because he couldn't style it, and that was a pure mistake on a person placing. Someone made a comment and asked, could this be a physician making sites in a wrong direction? So if some hairs are pointing backwards and some were pointing forward, I don't know any physician who would start with site like this and a site like that in the same. So in my eyes, my assumption would be it was the curl turn whichever direction versus a change of site direction. And it may be a little bit harder to recognize the FUE graft because you have to look at the epidermal cap, and if it sits flush, then you know that it is placed properly, and then the hair curl is going to point in the right direction, and if it's sticking out, that's an indication that it wouldn't. And what makes this one unnatural? It's a thick hairline, like nice density. The hairs are standing up. So this is purely hair angles error. So the hair angles were very, very high. But once you have a patient who had the result like this, you can say, hey, now we have to go with the extreme angle. If you go with the extreme angle from this to that, then the patient is going to have a gap. So you can't do that either. So you have to find a place in between so that from here is brought a little bit forward, lower, but not making a gap. The second thing is, if the hair shaft is straight in, once you start creating an angle that is much lower, then you're going to transect the previous hairs in by making sites. So they're going to interfere with the previous. So you have to be conscientious of what is going to happen while you're correcting and how it's going to look once it grows. This is poor result because of a poor healing. This obvious is a poor blood supply. As I mentioned earlier, it could be the depth of the sites, it could be a number of the sites where there's a tendency to make sites smaller. The smaller the sites, the more you can put, because it seems like, oh, I can fit a lot, and sometimes that can cause too much trauma. We have a patient who we were placing grafts, he looked fine, healthy, and all of a sudden throughout the graft placement, the skin started changing and started showing these gray areas. So it is also surgical assistant's responsibility to inform a physician if something changes, or you to step in once in a while and check, because it may look good an hour ago and then something may change. In this particular case, we sent him to hyperbaric chamber, and he did well in healing. In nitro-paste, yes, and we did nitro-paste while he was still in the office. This is a natural. Someone would say, hey, he had the strip surgery, so the strip surgeries are showing, and so that's what makes it a natural, but that's not really what happened. He had the strip surgery and he had a good density, but then someone convinced him that if they did the FUE procedure in this area, FUE is much better than FUT, it doesn't leave scars, but the patient was not informed that FUE is going to thin out his donor area, therefore the scars are going to show. Until this point, the scars didn't show. So you have to be conscientious of harvesting what is going to look like after the hair grows. So this was a poor planning plus over harvesting. What is unnatural in this patient, in this result? So if you look, this patient went and got hairline and temporal points reconstructed. So the tricky thing about doing hair transplant is recognizing that hair patterns can vary. And I am going to see how I'm going to do this. No. I need to, wait. I need to run a video. So this is a video. I want you to see, if you look this area, the hair is lighter, and if you come to this area, the hair is black. So when harvesting hairs, so if you look at the beginning of that video, the side of this scalp had the black and white hairs. So there were not just white hairs to select. You select the grafts that they're lightest, and then when they grow, sometimes they may grow a little bit darker. So selecting, if you look here, his donor area was very limited, low. That was where it was white. Everything else was darker. So now in retrospect, then 2 hair follicular units should have been split into purely 1 hair follicular units, but that was, what I'm trying to say is, even if you place the mostly white, 1 hair that is dark, it's going to overpower mostly white hairs. When we do either strip or FUE, we see that's a poor planning. That would be a good planning. You think, say, what are we restoring? Are we restoring temples? Is he white in the temples? We keep hair, white hairs for temples. If we're not restoring temples, we're just doing the top, then we're going to mix white and dark hair. So you don't want to do just one. If we're treating tissue with 1 color, it may group in 1 dish or 1 area. So you have to be conscientious while you're prepping your grafts that the things get mixed properly, and not trust that you're going to mix them while you're placing. So it has to be, before you start placing, the mixing has to happen, because if I take 20 grafts and mix with 50 dark, this person takes 50 white and mix with 20 dark. I don't know who mixes. If one person's in charge is better, or if you have slivers, you mix slivers. When you're slivering, you mix slivers. So you keep in mind what is going to look, what is happening now, but what is going to look once the hair grows. Okay, so that's, you saw that. And so to summarize all this, look back and say, did I plan this properly? Did the grafts got treated properly? So look at the different parts of your procedure to determine what could go wrong, but make sure that you have a good documentation.